Dr. Jacqueline Klopp, and she is the co-director of the Center for Sustainable Urban Development at Columbia University in the Columbia Climate School. And Jackie is a veteran of air quality and transportation research throughout Africa, and she spent a lot of her career doing this kind of work in Nairobi, Kenya, and more recently now doing some work here in Ghana. So we're very excited to have Jackie present to you today on her topic. So without further ado, Jackie.
Well, thank you so much, Dan, and the University of Ghana, Dr. Hughes. It's really a privilege to be here sharing with you today. So what I want to talk about is how to go from data and science to clean air. And there is a lot in between getting the data and the evidence and moving to actual clean air. So the agenda I have put together is to review some of the, and discuss with you some of the socio-political challenges to moving from science and data to clean air. And then to learn from successful cases of how we have actually got clean air in different places. And I'll draw from the United States, I'll draw from London, I'll draw from Kenya, and I'm hoping the next time I talk, I'll be able to draw a lot of successful cases from West Africa as well. And then I would like to explore together with you and have you discuss in groups like we did yesterday how we can address some of the challenges around mobilizing and really getting engagement from decision makers and communities to get to cleaner air here and in the places that you come from. So that's the agenda. So, oh, sorry, one sec. So let's look at the big picture. Overall, we know that it is very hard often to go up against those interests that perpetuate pollution and some of the deep-seated institutional and social dynamics that lead to pollution. We know that the atmosphere is absolutely critical to human life and to planetary health. We've talked about that already. But often what we see is that many different actors treat our atmosphere, our air that we breathe, as a kind of open sewer that you can dump anything into. And that has been happening for a long time in many of our cities, in our communities. So we have a complex mixture of pollution that we're breathing every day. And really the challenge, as you know, to addressing this is just really figuring out the sources, as we talked about earlier today, and showing as clearly as possible some responsibility so we can have accountability. And that's very, very hard to do. It takes a lot of resources and effort. And actually, you know, it's very easy to make a mess, to dump stuff somewhere, right? Or to burn something somewhere. It's much harder to say, let's clean this up and let's figure out how to get the incentives and the regulation and the societal buy-in to fix this problem so that we can be healthy together. And to understand this problem, it's one of the core issues. You have to recognize that polluters have this kind of advantage, that it's often easy to dump or get rid of your, pollutants in the air, harder to get the resources and the effort to create that accountability, and then to set up what you need to set up to actually clean it up. So polluters have a strong political advantage. in terms of the, this situation. And, many of the main polluters, the fossil fuel sector is one, for example, often deliberately, and also industry, often deliberately locate in places where there is the weakest regulation, where people are most powerless, right? And that happens at a country level, and then it also happens at a global level. So you see the relocation of industry often from places like the United States or Europe to Asia or Africa. Some of that's very deliberate in terms of evading regulations. You can see that with e-waste, you can see that with plastics. This is a very big problem. And then within countries, as was mentioned earlier today, that you often see the location of industries, the lack of services in poor neighborhoods, sometimes called informal settlements here, or overburdened communities in the United States, and they face disproportionate impacts. So that is a very big problem. And that is partially the dynamic that has led to the fact that, as a recent survey in the Lancet showed, in the last 2 decades, deaths from air pollution and toxic chemical pollution have really increased. And most of these, 90% of these deaths, are in places like Ghana. So these are the kinds of actual dynamics that we need to address. One of the really difficult problems with air pollution is that often the effects are cumulative and invisible. So air pollution has been called the invisible killer. And historically, in places like Europe and the United States, it often takes some sort of extreme event, like Dan was saying, like the London smog of 1952, for people to really see the impacts, to see the deaths associated with, air pollution under these extreme conditions. So how to render air pollution visible and its impacts visible is a very big challenge. And then another challenge is just the under-allocation of resources. The Clean Air Fund has been very good at documenting how little of our resources actually go into fighting this struggle, which I already told you the polluters have an advantage. So we really need to allocate resources. So I'm very much looking forward to the Clean Air Fund conversation after this. The Clean Air Fund came up with a report in 2020, and it showed that only $273 million over the last 5 years, from 2015 to 2020, was allocated globally to this ambient air pollution. And we've already talked about how many millions of people die. And it's easy to just have a number, but all the suffering and agony and implications of that are often just hidden when we give it a number. So these are the very big problems. And we do know that we can overcome these problems in our societies, and we do know that we have many successful cases. And I was actually extremely encouraged to hear some of what we heard this morning by these esteemed panelists. And I hope we can come back to that conversation when we have our small discussions. So one case that we're very proud of in the United States is the Clean Air Act, which came out of just exactly what's happening here today. A lot of scientific meetings, a lot of people coming together in the 1940s and 50s saying, look, this is a very, very serious problem, and a lot of mobilization to get the legislation in place. And this legislation worked. So we can see the data speaks for itself, that for a lot of these criteria pollutants, these main pollutants, we've seen the emissions decline over time. And over a time when the United States economy continues to grow. And so we can show that this regulation can really work. And it was very heartening to hear from the executive director of the EPA Ghana that more of this legislation is being put in place here with real enforcement teeth. And it's very important to calculate these health benefits, which the EPA does, and it shows that annually the measures put in place to control the emissions pay for themselves 32 times over, at least in terms of human well-being. So they measure, annually 370,000 premature deaths in the United States avoided, all that suffering avoided, 189,000 fewer hospital admissions for cardiac and respiratory illness, right? Lots of, improvements in respiratory illness, and it goes on. And they even measure the fewer lost school days from sickness that you get from these kinds of enforcing of these regulations. But of course, every struggle is imperfect. And one of the major critiques of our Clean Air Act is that many emissions have gone down across the country, but there are deep, deep disparities. In our underserved communities, we still have very high mortality and disease linked to high air pollution. Again, where a lot of the industries and expressways are concentrated. So there's a very nice study that was done that showed that Black Americans disproportionately suffer, and they're disproportionately in these underserved communities from air pollution. And so, as was mentioned, these disparities need to be addressed. So one way that we're trying to now address this is through much more community-based monitoring, much more explicit attention to environmental justice, and supporting communities to advocate for clean air. So there is a lot of work that the United States government is doing this, and the EPA, to address this problem. But what I want to say is, from learning from this experience, the work of getting clean air is a long-term process, and it's very iterative. You have to keep correcting, you have to keep pushing. And I have this diagram that I put together of what I think are a lot of the key elements. So in the little yellow boxes, you see what we've been primarily talking about, the research, the data, and the monitoring. That is a fundamental part of how you get clean air. But you need a lot of other things. You need laws. You need public awareness and source awareness so people understand where the different pollutants are coming from. That is often very hard. That requires a lot of outreach and engagement. You need litigation, because even though there are laws, people will try to go around them. And so there are many, many struggles that happen in the courts that have been very significant. You need institutional change. I was pleased to hear that Ghana EPA is moving towards trying to get more authority and more enforcement power. If, in fact, that enforcement power is used properly and with communities, that can have a big impact. And you need media, you need mobilization, sometimes you need protest to move forward. It's not a simple linear process from data and science to clean air. It really is a much more involved process, but we know we can do it. And one really great part of strategy is really focusing on public health. We know that there are climate change impacts, for sure, those are huge. There are, we talked about the ocean fertilization problems, the impacts on the ocean, the impacts then on fisheries, the impacts on agriculture, impacts on economy, but the public health argument really speaks to people. And one